Good morning, ladies and gentlemen. My name is Mary Caroline Fortune, and I will be speaking to you on behalf of Women Worldwide. Since its creation, Women Worldwide has campaigned for the betterment of health care for women across the globe. Today, we have come to support a promising new legislative proposal that has the potential to dramatically improve the quality of life of American women. The goal of the Open Avenues Act is to expand the scope of covered preventative care services amongst all citizens and improve the prospective evolution of our health care system. This act will not only build stronger, wiser generations of women and men, but also save countless lives by opening up paths to preventative care services that are currently exempt from the insurance policies participating in the marketplace and available to most employees through private plans. The implications of the law are virtually endless in their possibilities, but highly relevant to women's health and wellness. There has been much discussion regarding the Open Avenues Act over the past few months. Briefly explained, this legislation would expand upon the requirements outlined in 2010 by the Affordable Care Act to provide preventative services covered at 100%. When this stipulation was included, the purpose was to increase the quality of life of all citizens by promoting healthy lifestyles and providing screenings to encourage early intervention. However, the services provided are sadly short-sighted and in many ways discriminate against the female gender. A woman with a direct history of breast cancer is not eligible for a mammogram screening until she is 40. And even then, a lengthy pre-authorization process is required. A man who has a family history of prostate cancer is eligible to have PSA blood tests done beginning at age 18. This is not the only shortcoming of preventative coverage amongst insurance policies. Medicare patients, for example, are required to complete a PHQ-9 depression screening at their annual wellness visit in order to detect any signs of depression or other neurological conditions. Patients that are younger than Medicare age are more susceptible to mental health conditions, as these are usually discovered early on in life, such as in adolescence. There is no such service offered that covers any tests of screening for mental health conditions beyond basic depression for an adult over the age of 18. The standard well child checks also do not include any type of screening for these conditions. The Open Avenues Act presents all genders and races of all ages with an opportunity to receive truly quality care. But beginning with women is the most practical and easy implemented step. So to start off, let's examine a few of the reasons that healthcare has become such a challenging topic over the past few years. Starting with the creation of the high deductible plan. Until recently, these plans were rarely seen as an option for benefit plans. They are a trap, short, sweet, and simple. Patients pay lower premiums, but they have higher out-of-pocket costs for all services until their deductible is met. If someone gets a cold, they will be charged the full contracted fee of the office visit until said deductible is met. Therefore, they will pay their premium, pay for the majority of all services, more than likely have deductions from their paycheck for a health savings account, supposedly to assist with these high costs, and not be able to use that money at all in the event that they don't get sick. Patients learn to fear going to their primary care doctors. Women become scared to request a pre-authorization for a mammogram before 50 because then it's possible that their annual physical will not be covered at 100% because this would be considered outside the scope of preventative care or problem focused. By the time they've paid out of pocket to be screened, if they have such a plan, and get the order for the screening, which their plan will require, their deductible still might not be met. A diagnosis would lead to further treatment, at which point the patient actually would receive the coverage that they thought they were paying for because now they've met that deductible. If they're not diagnosed, they will have peace of mind but still face bills they never expected from the entire process. This is the result that we are seeing from the Affordable Care Act. This is the solution that the insurance companies that we pay every pay period have come up with to compensate themselves for the cost of having to cover more preventative visits for more patients. Why is it acceptable to corner our citizens into a situation that it's less expensive to get cancer than just to make sure you don't have it? According to the most current updates on breast cancer statistics in the USA, less than 15% of women who get breast cancer have a family member diagnosed with it. However, President Barack Obama's Affordable Care Act requires preventative medical services with a grade of B or higher to be covered. Under the draft guidelines released recently, a mammogram screening every 2 years for women 50 to 74 got a grade of B, meaning doctors should offer the service. Screenings for women in their 40s remained a C grade, meaning doctors should offer the service for select patients, depending on individual circumstances, which would indicate that if a patient had a direct relative that they had established family history, therefore the service should be recommended. This decision was based upon clinical trials indicating that the number of lives saved by mammograms in age groups below 50 was not significant when compared to the number saved in age groups 50 and above. How do we gauge how many lives are worth saving? Could it not be considered that the very fact mammograms are not covered before 50 unless there is an established family history, and even then only covered at 40, be the reason that there are not more recorded lives saved by them? Personally, this seems like a slippery slope to base such a life-changing decision on. Other services such as pap smears, which were covered every year prior to 2010, are now only recommended and covered for most women every 3 years. Under the circumstances that a woman has had an abnormal pap smear before, she's eligible to have an annual screening. Once again, why wait until it's too late? Despite the recognized benefits of cervical cancer screening, not all American women get screened. Most cervical cancers are found in women who've never had a pap test or who have not had one recently. Genetic testing is also now a popular form of early detection, and for women with established family history, it is justifiable to offer this service. But as we mentioned previously, only 15% of women who get breast cancer test positive for the gene. Testing for the potential of something that is already known to be likely is counterproductive when a routine mammogram only costs about $120 to the insurance company itself, and an annual pap smear is only around $200 on average. Genetic testing is much more expensive. Chemotherapy and oncology care, on the other hand, are more expensive than all of them. The children who are left without mothers at a young age because they couldn't afford to pay out of pocket for these services cannot put a price on losing them. So now we can look at how the Open Avenues Act will help. Let's focus on 3 things to cover this shortly. The intention of the Affordable Care Act was well-meaning from the very beginning, and it started a foundation to revolutionize the concept of American healthcare. But the transformation that we've seen over the past 8 years indicates that there's further need for improvement. Notice that in this review of the ACA from healthdeals.com, it specifically indicates that insurance plans are required to cover certain preventative services. It states, under the Affordable Care Act, non-grandfathered health insurance plans are required to cover certain preventative services, emphasis on the word certain, at no additional cost to insured individuals. As someone who has been on both sides of the exam room, my experience has shown that what this has come to mean is that if physical is covered every year, with strict requirements based upon age, demographic information, and gender. Family history, theoretically, is considered, but the female preventative services we are focusing on here are very difficult to get approved for full coverage prior to the threshold age of 40. The medical industry has turned the Affordable Care Act, into a tool to view patients as record numbers and checklists. This needs to be addressed before it becomes a permanent fixture of our healthcare system. To do so, the issue of providing preventative care services to a wider demographic of patients without raising costs to the patient also has to be addressed. There's enough medical evidence present to justify these services, along with prostate cancer screenings for men, diabetic screenings for adolescents, and depression screenings for all age groups, including children, to be included into a preventative care category that qualifies for full coverage. In the case that the corporate world doesn't agree, chooses not to comply with the changes that the Open Avenues Act is proposing, then the responsibility passes to us as citizens and our local governments to find ways to make these services available to citizens. Tax dollars that have gone to supporting insurance companies enrolled in the ACA can be redirected to directly provide care to the community. The concept that insurance is required to receive care is the worst example of economic inflation. Why not bring these things straight to the people? Why not cease the federal funding of private insurance companies and send it to the health departments that are so grossly underfunded and understaffed? Educational programs, basic digital imaging such as mammograms or x-rays, vaccines, physicals, drug counseling, sexual education. The list of needs can go on forever. However, none of it has to be confined to a private hospital or dumped into the insurance company's account with the hopes that it will benefit the community. Change can take place within our neighborhoods for our citizens and keep our tax money inside our communities by providing the services needed directly to the people. In the United States, we spend more than any other country per person on healthcare than any other country in the world. Yet our people have a lower life expectancy than any other nation within the globe. There's a clear and obvious flaw in the system that invests more and receives less. Health insurance is a staple in the infrastructure of our healthcare system, and with good reason. Coverage for catastrophic care or chronic conditions that require expensive long-term treatment is a smart investment. Industry's there for a reason, and our economy is fueled by the jobs and revenue created or generated by the healthcare industry as much as any other industry. However, if government is going to play a role in determining how policy is created, it needs to be the mediator to make sure that coverage is there to provide the right services for the right price. Limiting access to preventative care is the antithesis of promoting personal well-being for patients. Patients should not be scared of the price tag that comes with taking care of themselves. Our purpose here today is to review the implementation of a law that will ensure that these services no longer have limitations on them, that they can become truly accessible to all. Thank you very much for your time. Have a great night.